So as we all know, this past year has been quite challenging and unprecedented in our lifetime. Our students have experienced what many of us as adults have experienced, a lot of unknowns, therefore heightened anxiety. We were triaging mental health needs in March of 2020 when we transitioned very quickly to distance learning or remote learning, and we were triaging through the end of that school year. And so we knew we had to strategically plan for back to school in August because we were seeing the heightened anxiety.
COVID has made providing the services, particularly the navigation services, harder. It's made it harder because the economic challenges for the families that we're working with, many of them were already severe economic challenges and now they're worse.
All of the mental health issues that were ongoing before the pandemic have gotten much worse. Every measure of mental health that we have is worse. Depression, anxiety, trauma, substance use, domestic violence, suicidality, opiate overdose, they all are off the charts.
I had the opportunity to care for a family one night during this pandemic. And this was a 9-year-old boy, and his mother said that he had been asking to see the doctor over and over again. And she kept telling him, "You're fine, there's nothing wrong." His physical complaint, that was true. There was not anything significantly wrong at all. This 9-year-old boy broke down crying, and he told me that he was so sad. He didn't want to wake up in the morning. He didn't want to tell his mom because he could tell his mom was so sad too. And he didn't want this to be another burden on her. He said that he could hear her crying and worrying about money. He's 9 years old. That's what this pandemic has done.
So just in the past year alone, during the pandemic, between April and December, we had 116 children under the Baker Act. When we look at the last quarter alone, we had a 13% increase compared to last year.
A Baker Act is an involuntary admission to either the hospital or a mental health hospital for mental or behavioral health issues. It can be assigned by a police officer, a school counselor, a physician, and it is done when there's a belief that a child or adult is either a danger to themselves or others.
Our goal is to not have to transfer individuals. It's that much harder to coordinate care with the parents and family and to establish aftercare appointments and follow-up care with providers and promote that continuity of care. So we want to do whatever we can to serve those Baker Acts here in our facility, but it's been really challenging to do so.
So with an organization like Kids Minds Matter, that's an opportunity to engage the community in a productive and constructive way to get the message out, to help the community understand the need for donations, the need for involvement, the need to tell our story, the need to shatter stigma, achieve parity, and most importantly, to obtain the resources that we need in order to take care of this growing demand. The CDC has indicated that we're seeing a 40% increase in folks that are in need of services. And of course, many of those are children. We're seeing that at our own organization and all of the organizations throughout Southwest Florida.